This is Brainstem with your host, neuroscientist Dr. Hilary Marusak. Production by Amanpreet and Manmeet Bogle. Welcome to episode 6 on human-animal interactions and mental health. Today I'm going to start by talking with Nikki Vitel, who began her second career as a mental health counselor with a specialization in animal-assisted therapy. She completed her master's in education in counseling psychology with concentrations in addiction disorders and trauma. She now works with dual diagnosis clients, many of whom are homeless. She has seen the transformative power of animal-assisted therapy, or pet therapy, as she works with her own registered pet therapy guinea pig named Calvin, who I understand we're going to meet today. Nikki's a registered pet therapy handler through Pet Partners, and she completed the renowned certificate program in animals and human health from University of Denver's Graduate School of Social Work. All right, Nikki, thank you so much for joining us. Well, Nikki plus a friend, which we'll meet in a minute. I think everyone knowing me is not going to be surprised by the topic of today's podcast. Animal-assisted therapy and the mental health benefits of animals. Very excited to talk to you, Nikki. Thanks for taking the time. You have such an interesting background. Can you first talk about your background and how you got into animal-assisted therapy?
Sure. Yes, and it's a pleasure to be on your podcast, Hilary. So I started doing this as a volunteer, and I don't even remember exactly what I was Googling the day that I sort of, happened upon some information about animal. It was just being called pet therapy then. And there was a program here in the Boston area. Well, it's actually out of the Tufts Veterinary College in Grafton, Massachusetts. And I saw that they were looking for volunteers to help them with their pet therapy evaluations. And so I thought, I'll do that. And I went, and it was really interesting. They were all dogs that were being evaluated for Pet Partners pet therapy visits. And I said to the woman, Deb Gibbs, person who changed my life, I said, I would love to do this, but I only have a guinea pig. And she said, oh, we would love to have a guinea pig in our, in our group. And Pet Partners, which is really like the gold standard of pet therapy organizations, it's international, recognizes 9 species as appropriate pet therapy animals, and guinea pigs are one of them.
Do you know the rest off the top of your head?
I do.
Just curious.
Dogs, cats, rabbits, guinea pigs, mini horses, mini pigs, llamas, some birds, and domestic rats. Okay. So, and the reason I have a T-shirt from them that has all the
you can kind of phone a friend there.
Right. And so I had a guinea pig at the time named Ralphie, and I learned what Ralphie and I would have to do. I had to take a course, and Ralphie had to pass a behavioral evaluation. And he was the first registered pet therapy guinea pig in Massachusetts. And what happened was Deb asked me if I would mind volunteering at a forensic psychiatric facility. And I wasn't even sure I knew what that was, but it sounded very interesting. And it turns out that it's a facility that has as its population adults who are somewhere in the criminal justice system. Some people are being observed to see if they're competent to stand trial from a mental health standpoint. There were some patients there who were coming up from some of the prisons in Massachusetts, presenting with severe enough mental health challenges that they needed to be in a different kind of facility. So, I thought, well, this will be interesting. And I went in with Ralphie, and the patients adored him. They absolutely adored him. And I would go in, I think, 2 or 3 times a month with Ralphie, meeting all kinds of different patients. And they would have a group. I would have one of the staff with me all the time, which was a security measure. And, the staff person started hearing back from the unit nurses that the patients it was very unusual for some of these folks to be attending group. Some of them didn't ever go to groups at all. They would come to, the group when Ralphie was there, which was nice. And, these are a lot of individuals, men and women, who yeah, they presented in a tough fashion. I mean, that
Sure.
was working for them in the environment they were coming from. And then when they were with Ralphie, they would be so sweet and loving and tender, really just so wonderful. And really look forward to the meetings. And there was one patient who especially loved Ralphie and was his buddy and was very protective of him. I never had to worry when I was visiting with that patient. He was very, made sure that all the other patients knew how to handle Ralphie. And one of my favorite stories is guinea pigs don't live that long, unfortunately. And Ralphie had passed away. And I got another guinea pig who then passed his test, named Stuart. And I was visiting with Stuart one day at this facility. And this young guy is saying he's having a great time with Stuart. And he keeps on saying, he's so G. He's so G. So I'm thinking, G for guinea pig, I mean, he's so G. So finally I said, I just need to ask you, what did G? And he looked at me and he said, he's gangsta. He's the total definition of gangsta.
That's awesome.
And and I'm looking at Stuart, and Stuart was like a very chunky guinea pig. It was 3 pounds. After that meeting, I texted Stuart's vet and I said, I want you to know, you have a gangsta guinea pig as a patient. And he just thought that was fantastic,
That's so funny.
and that was how he got to be known after that, was Stuart the gangsta guinea pig.
That's so funny.
It was really fun.
3 pounds is huge for a guinea pig too.
Yeah,
he must have been a chunker.
He was chunky. He was chunky. But what happened was I really, really enjoyed this work so much. And I was getting really good feedback from the staff. And, the person that I worked with, who was kind of my main facilitator, was saying, you're good at this. And, I just thought I need to look into this. And I ended up going back to graduate school and getting a master's degree in counseling psychology and doing this big career shift. I had been a producer for PBS for the majority of my career up until then, and had my own company, and just realized that my soul work was taking me in a different direction. So I then got involved with doing group therapy and incorporating animal-assisted therapy into that. So
that's awesome. Yeah, and it prompted you to change your career 180. So it must have been so rewarding for you.
Yeah.
I'd love to hear a little bit about what the therapy actually looks like. So is it always in a group setting? Do you ever do individual?
I'm actually work as a group therapist, but the way that I do the group therapy is, and I will tell you that the topic that is a great springboard to discuss with the patients is the topic of trust. So I'll introduce the idea of trust. What are the qualities of trust? How do you get somebody to trust you? Let's unpack what trust is. And people will say, well, yes, consistency and reliability and affection and empathy and compassion. And we'll talk a little bit about whether any of the patients in the group have had pets. Usually many of them had, and talk about how they created their bond with their animal. Some of these same qualities. And then what I'll do is I'll bring in Calvin, he's the hardest working guinea pig in New England.
All right, we need to meet Calvin now.
Okay, well, let me get Calvin here. He is quite Calvin.
The big reveal.
The big reveal.
Our special podcast guest today. And you have to show your t-shirt.
This is Calvin. This is Calvin. Hey, Calvin. It's time for your close-up.
Cute. Oh,
yes, yeah. I know. He's a teddy breed, and he's and he's talking.
That was perfect.
You have something to say. Of course you do.
Well, his mom is an ex-producer, so I'm not surprised. Right. He knows all of his cues.
So, and I have a little, like a cuddle cup that I put him in. And then all of the patients who are interested get to have him on their lap. Now, Pet Partners requires that he wear a little leash. I don't walk him or anything. It's just so that I have a hold on him. And the patients can have him on their lap, and they can pet him, and they can feed him. And watching guinea pigs eat, for some reason, it's just one of those things that releases a lot of dopamine into your system.
There you go. It is a neuroscience podcast after all.
Yeah, right. And, the other thing, you want some of this? Oh, yes.
Oh, you guys have to check out the video version of this podcast on YouTube. This is great. I should shot.
He's having a veggie treat.
I should bring up my dogs. So I have 3 dogs and 1 horse, and each of them do not eat like that. Like they would just inhale the food.
Right. No, he eats one bite. In fact, yes, I always say that guinea pigs eat the way we should eat. They chew very thoroughly. They swallow. They take their time. They savor their food. They don't sort of, just push it into
Yeah, they practice like mindful eating. Look at him.
Mindful eating.
It's very therapeutic already.
Yes.
Can you talk about some of what your patients have found in terms of the mental health side of things?
Yes. So one of the things that was very apparent on the forensic units, which were no-touch units, okay? So no one was allowed to touch each other. The staff weren't allowed to touch. Being able to have a guinea pig in their lap and pet that guinea pig and just having that tactile connection was huge for them. It was really big. And and it was they would say that their stress level had gone down. Mm-hmm. Being able to just be a person with an animal and just have that animal respond to them and be mindful, because the hospital where I work uses dialectical behavior therapy as its approach. Mindfulness is a big piece of that. And we'll talk about, when you're with an animal, you're usually in the moment. And I always say, like, Calvin is in the moment. Calvin's not worrying about what happened yesterday. Right now, he's not thinking about what he might do tomorrow. Right now, Calvin is having the best time ever eating his veggie treat.
He sure is. I can attest to that.
Right. And and animals model mindfulness for us. and they will pull somebody in, with them to do that. So that's very positive for them, and he makes them smile. He's
Obvious
just
mental health benefits right there.
and a lot of my patients, they've been homeless, they're in a sober house now, they're concerned about where they're going next. To have something that just makes them feel just joyful in the moment is priceless, so that's what a little guy like this can do. And it's also, we'll say it's not your size, it's what you bring to the party. So yeah.
Yeah, that is super interesting. That I never thought about that you could use an animal as a tool in your therapy. So introducing a concept like trust, which you mentioned in the beginning, or
Yes.
something like mindfulness, and actually like bringing in this tool that automatically makes people become mindful, and then introducing that as a concept. That is really cool.
Yeah, it
Is
is.
that kind of how animal-assisted therapy is supposed to work? Because we're going to hear a little bit about the science later on, but I want to hear
Yeah,
your perspective.
there's so guinea pigs are different. I mean, most animal assisted therapy happens with dogs. And so there's a lot of different things that folks can do with dogs, and in terms of interacting with the dog or having the dog do a trick for you and stuff like that. He doesn't know, some people say, he doesn't do any tricks, and I'll be, yes, he eats out of your hand.
There you go.
But one of the things that's interesting is that a lot of people are afraid of dogs. We don't realize how many people there are who have a fear of dogs. And there are some cultures that don't embrace and celebrate dogs the way we do. So having a smaller animal that is something that can be on your lap and that is a little calmer than a dog might be, can be a very different experience for people. Some patients will say, "Oh, I had a guinea pig when I was a kid," like you were telling me before we started. So it's a nice memory. Other people will be like, "I never met a guinea pig in person before."
So is a guinea pig a rodent, Nikki?
I'm glad you asked, because sometimes people go like, "Oh, it's a rodent," and actually, there's this raging debate in the biology zoology world about whether they're rodents or not. And some people, some researchers, did some deep dives on their DNA and found some things that maybe don't make them completely compatible with the rodent family. So that's that's one thing. And I wanted to say something else about the patients that I work with. They feel very vulnerable, and for good reason. Many of them have been on the streets. They've battled addictions, and I always felt that when they were working with or having fun with Calvin, they could be with a creature who was he's done with his cookies, so he's like, and now what's next? That they felt that they could be taken care of. They felt protective in that moment. They were perhaps less vulnerable with a more vulnerable animal. And
Interesting.
yeah, and there was a wonderful exchange that I got to observe with two male patients. One of them was holding Calvin, and I was watching. I had Calvin's leash, and the other guy said to him, you're going to be a good dad one day. And I thought, wow, this is an interesting conversation. And the other guy said, you think? And this first guy said, well, yeah, I mean, look at the way you're holding Calvin, and Calvin's so comfortable with you. And that really means something, man. That means that like you're just going to be a really good dad, I think. And it was such a lovely moment for both of them. Not the kind of conversation they normally would have had.
Sure.
So it elicits a lot of interesting feelings and thoughts that don't happen in the usual way that we do groups. So
Absolutely. What are
yeah.
the different types of groups? So do you have patients who are, struggling with addiction issues? Are there specific groups that this works better for or less well for?
Well, most of the folks that I work with, and I've also done other groups at the hospital where I work. There's a women's program. There's a general adult psychiatric program. And a lot of those patients are suffering from anxiety. I mean, anxiety is a thread that weaves its way through many, many mental health challenges and stress. So we know from the research that petting an animal reduces your stress and reduces the animal's stress. So they will, really say, oh, this is just so great. I think it also goes back to that mindfulness moment that when you're holding an animal, you're completely focused on the animal, especially a little guy like Calvin. So at that moment, that's all there is in the world, is that person and Calvin, and the stresses and the anxiety can be reduced. So that's
That's
what
really cool.
we talk about. And I will say, I haven't had this experience, but there are several wonderful studies on kids on the spectrum interacting with guinea pigs. And after having time with the guinea pig, the child is found to be more sociable, can make eye contact, more focused. So I just find that very, very, very interesting.
Yeah, definitely.
Yeah,
The mindfulness stuff is super interesting to me. That's something we study a little bit in the lab, but one of the best, methods to reduce stress and anxiety is mindfulness, and
yes,
just practicing it every week by, seeing Calvin and putting yourself in the moment and practicing doing that. It becomes more habitual to you, and it has such broad benefits for people with and without psychiatric disorders. So
right.
very
And
cool.
it's tangible. A lot
Mhm.
of the folks, they'll have a tough time meditating. Okay. Especially people who are in early recovery. There's a certain amount of brain fog that's going on when people
Mhm.
are in early recovery. Their brains are still, um, pretty much in an addictive space.
Mhm.
So, you want to say goodbye? All right. I think Calvin, and this is the other thing I'll say about self-care. I'll go back to the other thing. Calvin, these guys model self-care.
He's like, it's
When you,
bedtime.
he's like, okay, this is cool, but you know what? I need a break now. So it's okay to take a break. And I'll tell them that, it's like Calvin knows what he needs to take care of himself. And it's not a bad model for the rest of us. Um, but yeah, so I don't actually remember what I was saying before. Calvin
I was
made
watching
his
Calvin
wishes
too. I lost
known.
it.
Made his wishes known. Let me just put him back in his little case. I actually have a second guinea pig named Hermie. Hermie is younger than Calvin. I'm not sure about Hermie's future.
Not going to pass
Hermie,
the therapy test.
well, he's he gets distracted easily.
Like many of us.
I call him my little ADHD guinea pig. He's just
Aw.
sort of, he's very interested in everything that's going on. So he's always looking around. We'll see. He's also younger. He's only a year and a half. So maybe, but he spends most of his time bugging Calvin. I mean, that seems to work out for both of them.
Absolutely.
Right,
So,
right.
question for you. So, if someone wants to either volunteer or try something like this, what would you recommend?
Okay. Oh, that's a great question. And I get to go on my soapbox a little bit because
Have at it.
I think that Pet Partners is a wonderful, wonderful organization. These guys all of the pets have to be evaluated every 2 years because, animals sometimes outgrow their interest in doing this kind of work. More so, I think, with dogs. Dogs can get, they can just get like, I don't want to do this anymore. Calvin, so Calvin's 4 years old, knock on wood, he's very healthy. So the way to do this is to go on the Pet Partners website, which is www.petpartners.org. And there is a lot of information if you want to volunteer. There are certain rules. If you have a dog, you have to have had that dog for at least a year. If you want to do something with a guinea pig, you have had to have the guinea pig or rabbit for 6 months. They want you to know the animal. So it's not like I'm going to go to the store and I'm a big advocate of going to a shelter. There are a lot of guinea pigs, at shelters. And also that way if it's a good shelter, they'll know what the personality of the guinea pig is. You kind of want a guinea pig who's interested in people, but Pet Partners will walk you through. You have to take a workshop, and you can do online now, and sometimes you can do it in person. It will tell you in your area if there is a Pet Partners affiliated chapter, and that's who you end up being with. And they will end up doing the evaluation of you and your animal. And then, depending on where you would like to visit, lots of people visit nursing homes. There's this fantastic, how many dogs do you have, Hillary?
3.
Not that you have
Too
this much
many.
time on your hands, but you'll appreciate this. There's this wonderful program called Read to Me. And if your dog and you are registered pet partner handlers, and your dog would enjoy this, and now that we're going back to sort of normal life, so the dog goes to the library and kids read to the dog.
Oh, that's cute.
Yes, and what it does is it helps children who may be self-conscious about their reading. Read to a non-judgmental, unconditionally loving animal. And that is really a lovely program. And we have a couple of people in our chapter who have Newfoundland dogs. So the kids lay on the dog and read to them.
Oh, that's a good breed.
Newfies are like, right, having a nice big cushion. So yeah, so that's, there are a lot of different ways if you're interested in doing something like this on a volunteer basis of finding what works best for you, and your dog, or your rabbit. Rabbits are very cool. I wish I could have a rabbit, but I have a cat who is kind of the star of, she's a diva. And if I brought anyone else in, she likes the guinea pigs and they like her, and that's cool. But I think that's about as far as we can go.
Understood.
But people love to visit with rabbits. And we don't have any llamas, but we do have in our group a couple of mini horses. And oh my goodness, I mean,
super cute.
They're amazing, right? They're amazing. So it's a wonderful organization, and it's a wonderful program. And it changed my life,
Yeah, clearly jumped careers. Is
Yeah.
Pet Partners international?
It is. I mean, there's Canadian, I know that they do webinars a lot, and people will be calling in from all over the world
Awesome.
to, to do the webinar. So yeah, I
Yeah,
think for
great.
the guinea pigs, some countries are more guinea pig centric. The UK, right? The UK, very big on guinea
They love
pigs.
their guinea pigs.
They
That's
love
so
their guinea
funny.
pigs. Germany, very big on guinea pigs, interestingly. Yeah. And so, there'll be people who'll be sort of exchanging information about that. I mean, the other thing about having an animal like a guinea pig is you have to have a good veterinarian, because these are not disposable. I mean, these are animals that have a lifespan. Some guinea pigs have lived till 10 years, and you need to have a quote exotic pet vet. So you have to find a veterinarian who does not only treat dogs and cats, but
Mhm.
treats the exotic species. And I'm lucky being in this part of Massachusetts, and with Tufts Veterinary College, there are a number of veterinary practices with wonderful exotic pet vets. And the guinea pig boys, as they're known,
I bet they loved
are very
G.
popular
That's awesome.
at
I'm
the
glad
vet
Calvin is
practice.
is getting care. What a cool
Yes,
opportunity though. So guys, go to that website. I'll link to it in the bio if you want to get involved in something like this. Wonderful
yes.
opportunity. I'll give you the last word, Nikki, and while you're doing that, I'm gonna bring up one of my dogs to say hi.
Oh, that's good. Oh, that's good. Well, I do think that if you're listening to this or watching this, and oh my goodness, I was going to say, and you love animals, and you've seen the way your animal can help you, and you want to kind of pay it forward a little bit, I think this is a good way. Oh, who is that?
This is Maggie. She's a rescue. She has 3 legs. Her back leg is missing.
Yes, Maggie. Oh, she's beautiful. It's interesting. I will say that some people who will have an animal with some kind of disability will often find that visiting in schools and with children who have disabilities, that can be a very beautiful moment. That
That's cool.
understanding that disability does not have to hold you back, right?
Exactly. Yeah, I love that
Yeah.
message. I don't know if she'd be a great therapy dog. She's more like a cat. She just likes to hang around.
Yeah,
But I
well,
love that message.
that's yeah, with dogs especially, there are different personalities with dogs, and sometimes people will come in for their evaluation and the dog won't pass the evaluation the first time. And they'll get some tips, because the dog evaluation, um, they have to be very obedient, because when you
Sure.
go into an environment where there may be loud noises and things clanging around, and people and kids, and they run up and stuff, you need to be able to be a good advocate for your animal,
Hmm.
as well as be understanding for the people who you're working with. So anyway,
Absolutely. So
yeah,
no crazy dogs. All right, Nikki,
no
thank you
crazy.
so much. This was so wonderful, and it was great to meet you and great to meet Calvin, and keep up the good work.
Oh, thank you so much, Hillary. And it was lovely to meet Maggie, right?
Yes.
Maggie. Okay. All right. Thanks so much.
Thank you.
Okay.
right, that concludes our interview with Nikki and Kelvin. Next, I'm going to speak with Dr. Megan-Mueller, who is an Elizabeth Arnold Stevens Jr. professor and an assistant professor in the Cummings School of Veterinary Medicine at Tufts University. Dr. Mueller's research program focuses on a developmental approach to understanding human-animal interactions, including both pet ownership and animal-assisted interventions. Her research includes identifying the effects of pet ownership on adolescent brain development, family functioning, and animal well-being. Her recent work has focused on human-animal interaction and resilience in youth with social anxiety. All right, Dr. Mueller, thank you so much for joining us. Can you just give us a little bit of your brief background and how you got into this area?
Great. Thank you so much for having me here today to talk about one of my favorite topics, human-animal relationships. So this field is really interesting because there's a lot of scientists working in it from lots of different fields. And I sort of happened to stumble into it serendipitously. I'd always had an interest in animals, thought maybe I wanted to be a veterinarian when I was a child, but ended up going in college the psychology route. I was really interested in particularly youth development and youth mental health. And then I was actually at a conference in my first year of graduate school, and I went to a symposium on this new field of human-animal interaction. And I thought, well, this is perfect. This is exactly what I want to do. It really merges my interests in animals and my interests in youth development and mental health more broadly. So I never looked back. I went back and said to my PhD advisor, I need to switch my thesis topic. And to his credit, he said, great, that sounds really interesting. Go for it. And so I sort of took it from there. So I have a degree in human development, but I work at a veterinary school, which is fun. I love working with veterinarians, and I study human-animal relationships in lots of different forms, primarily pet ownership and animal-assisted interventions. And so it's a really fun field because it is really disciplinary. We have folks from veterinary medicine, from psychology, education, engineering. Everybody's kind of collaborating, and so that's what makes it fun.
Awesome. Can you start by defining some of the terms you just mentioned, like animal-human interactions? What is animal-assisted therapy?
Sure, absolutely. It's kind of alphabet soup with all the acronyms that we use.
So, always in science, right?
Yes. Well, why use fewer words when you can use more? So we have human-animal interaction is the term that is used to describe sort of broadly human-animal relationships. So this can include pet ownership. It can include animal-assisted interventions, human-wildlife interactions, also the field of anthrozoology, which is the field of studying human-animal relationships across many different spheres and many contexts. It's very broad. It's sort of a broad term. Then we have obviously specifically pet ownership, which is one area of research, and then animal-assisted interventions, which involve more structured interventions where typically therapy animals are incorporated into therapeutic practice in some way. When it's animal-assisted therapy, that's when we have a licensed human healthcare provider that's working in their scope of practice with a therapy animal. So for example, if you have an occupational therapist who's working with a therapy dog to help their client meet specific goals. So it can be a little bit confusing sometimes, the different terms, but we have, because these relationships are so broad, we have lots of different areas that we can study.
Yeah, and I didn't even think about some of the aspects you just mentioned, like interactions with wildlife, for example. And I think a lot of people listening will really relate to this if they have, cats or dogs, or, we were just talking about horses offline. If they have animals in the home, or if they've heard about some of these therapy interventions for, whether it's like the pony that comes to the children's hospital, or, structured therapy for adults with PTSD, for example. I think this topic is really interesting, and I share your enthusiasm. You work in a really cool area. How prevalent is this? Like, how many people own pets? How many people participate in this type of therapy?
Yeah, that's a great question, and actually a really difficult one to answer because pet ownership is not on the census, the primary census. We don't really have census level data, and estimates have kind of varied depending on who has done the estimates and what the methodology is. But we think around 2/3 of households in the United States have at least one companion animal. So, that's a lot of families. Obviously, it's context specific in terms of cultural differences in pet ownership. And actually, one of the limitations of the field is that the majority of the research on human animal interaction has been done in the United States, Europe, and Australia. But I think there's more work being done looking at rates of pet ownership in different cultural contexts, and even what does having a pet mean, right? If you have a feral cat who you feed in their backyard, are you considering that animal your pet? So even the definition of pet can really be fluid for a lot of people. And similarly with animal-assisted interventions, we have no real centralized way of collecting data about how many people are engaging in these interventions. Pet Partners is one of the largest therapy animal organizations, and they've been doing a lot of work trying to collate that kind of data, but it's certainly expanding in interest and practice. Also, the use of service animals is increasing, and emotional support animals as well. So lots of different types of ways human animal interaction is integrated into society, at least in the United States.
Awesome. Okay, let's get into some of your research and in the research on this area, because I think a lot of people will be kind of familiar with the general belief that animals and pets are good for your health, but they may not know if science actually backs that up. So very excited to hear from you. Can you talk about some of the research in this area, including some of the challenges, what the findings are, what still needs to be done?
Yeah, I think it's a great question, because there is this belief that pet ownership our pets are good for us, right? That's why we have pets, theoretically, right? We all, have personal relationships with that. And so I think the research is actually a little bit more mixed than people might think, based on our personal anecdotal information. And it's interesting. There's been sort of different findings depending on what kinds of outcomes you're looking at. The field really started with some initial very strong findings regarding cardiovascular health and recovery from cardiovascular events, particularly related to dog ownership. So I think this idea that having a dog might help you be and stay more active is something that has gotten some support in the research. And with regard to mental health outcomes, it has been a little bit more mixed, especially with pet ownership. So we actually see in some cases that pet ownership is associated with negative mental health outcomes. However, there's this really interesting challenge that we have with pet ownership, in that pet owners are often systematically different from non-pet owners, and that's what makes it so complicated. Often when we're testing some kind of intervention, the gold standard is to do a randomized control trial where you assign people to a condition. You can't really assign people to have a pet. People like to choose whether or not they have a pet, and they like to choose what kind of pet they have. And so it's really hard to disentangle some of these effects, because we don't know whether people who are more active are more likely to get a dog, or people who have a dog are more likely to be active. Probably it's a combination of both. Mm-hmm. And so I think the science has started to get a little bit more sensitive to that, and we're starting to use methodologies that can help tease out some of those specific findings. But I think that's why we've seen some of these more mixed findings regarding pet ownership. With animal-assisted interventions, which are a little bit more controllable because you're talking about a more structured intervention, there has been some research on short-term anxiety reduction, a reduction in pain levels during different medical procedures. So I think there's some nice short-term outcomes associated with animal-assisted interventions. I think where we need more research is on longer-term outcomes. And also the idea, especially in mental health settings, of dosage, if you will, of animal-assisted therapy. Is it something that you need to engage in every week for the rest of your life? Can you do a 12-week session and that has some kind of lasting benefits? So I think there are a lot of different questions there, especially given the range of different kinds of mental health outcomes that are targeted in these different animal-assisted interventions.
Mm-hmm. That's so great that you guys are using kind of the gold standard medical approaches to really get at whether or not this works and what the quote unquote doses are that actually have therapeutic benefit. I love that. Sounds like so much work needs to be done in that area. And what you mentioned about like the adverse effects potentially is really interesting to me, especially with pet ownership, as you mentioned, because I think I'm just thinking of it like a couple different situations where like having a dog, for example, comes with its own level of responsibility that could be, additional stress versus it's also kind of like the chicken or the egg problem. Like if you want a dog because you're already depressed and you think that that will help you feel less lonely, well, then you've already got kind of a bias between the two groups. So I think it's really interesting to hear that you guys are starting to tease apart those different factors and see kind of what the effects are there.
Yeah, I think you've really hit the nail on the head. There's these two different issues. One is this idea of selection effects of who decides to get a pet. And just as you said, if you're experiencing loneliness, you might seek out having a pet as a way of adapting in a positive way to that experience. So that could actually be a positive thing. And then, of course, there's also the responsibilities and the stress associated with pet ownership. I'm sure we've all had experiences where our pets have stressed us out in some way. And sometimes it's really minor, right? My dog walker can't come today and I'm stuck at work. And what do I do? Sometimes it's more long-term, this idea of caregiver burden, which is prevalent in the human medical literature, the idea that there's a burden on those who are caring for sick family members. There's been some really interesting recent research showing that phenomenon happens with pets as well. So if you have a pet that's sick, you experience similar caregiver burden. So there's that kind of responsibility. And then there's also some barriers to having sort of a positive pet relationship. One of the things some of my colleagues are looking at is access to affordable veterinary care. So similar to access to healthcare, some folks may be familiar with the term a care desert. If you don't have access to affordable veterinary care, does that diminish some of the benefits you're getting from pet ownership because you're feeling stress about getting adequate care for your pet because you care about your pet? So there's a lot of different sort of barriers here. Housing is another one. If you are having challenges finding pet-friendly housing or pet-friendly housing is more expensive, that could be another barrier. Mm-hmm. So I think it's really interesting to move beyond looking at just the individual human-animal relationship and thinking about the whole context of what's going on, which makes it a research challenge, but also makes it more interesting to study.
Absolutely. Yeah, we were just resonating on that point about older animals before we started recording, and we both got older dogs, and with that comes a lot of extra caregiving responsibility, as you mentioned. So that's really interesting to think about. I wanted to ask you about species, because I think a lot of people consider themselves to be like cat people or dog people. Does it matter, like a goldfish versus a dog versus a cat versus a guinea pig, which we just heard about?
Yes, absolutely. It's a great question. And I think the question is valid for both pet ownership and animal-assisted interventions. So I'll start with that, which is that the majority of the research on animal-assisted therapy has been with dogs, just because dogs are the most prevalent species used. However, we do, even in our own therapy animal group, we have multiple species: guinea pigs, cats, miniature horses. Equine-assisted therapy, of course, is a whole field in and of itself. health. So most of the research has been on dogs, and there hasn't been a lot of comparative work looking at different types of species in that setting. I think even within dogs, you think about the experience of interacting with a Chihuahua versus interacting with a Newfoundland. That is really a qualitatively different experience. And I think that's something we need to explore a little bit more. I know for some folks who are maybe afraid of dogs, interacting with a smaller animal like a guinea pig or a rabbit can be a more accessible way of getting involved in animal-assisted therapy. So I do think we need to explore a little bit more, especially about the match and the fit between the situation. If you're working with high energy teenagers, that's going to be a different kind of situation than when you're working with older adults, for example. So figuring out what the best match is makes a lot of sense. With regard to pet ownership, with apologies to the cat owners, dog ownership has starting to more consistently emerge as being associated with more positive outcomes. I think for physical activity, that we can sort of see the mechanism there in that dogs often require being walked or being outside. And so it's kind of a way of engaging in more physical activities or healthy coping behaviors that include being outside, walking. So I think some of that is emerging, but it may be a function of how we interact with dogs. Dogs they're social creatures and interact with us socially. So that might be part of what's going on. And that's not to say that other pet ownership is not beneficial for lots of people. I had a student who was very much attached to his fish. And he said that was really calming for him to watch the fish, and it was very meditative. And so I think one of the wonderful things about pet ownership is that there's sort of something for everybody. And so maybe you're a dog person, maybe you're a cat person. So I think it's about optimizing that particular relationship. But that being said, I would say with regard to the research evidence, dogs do sort of tend to come out more on top, at least for now.
So interesting. And yeah, I've got a couple that are extremely social and they cannot be 5 minutes without me. So that makes a lot of sense. Can we talk about the other side of the equation? So differences in people, are there certain groups or demographics, patient groups that tend to benefit more from either interventions or pet ownership?
Yeah, I think that's also a really good question, and one that is starting to be addressed more in the science, but I wouldn't go as far as saying that there are firm answers about that yet. We have a challenge where women seem to be more likely to participate in research on human-animal interaction. This is sort of wrapped up in the idea that it's hard to get people to participate in research on pet ownership if they don't have positive relationships with their pets, so you have a little bit of a bias there. We do see that there are some sociodemographic differences between pet owners and non-pet owners, and some of that might be tied up in housing, access to housing, pet-friendly housing. There may be some cultural differences in different types of pet ownership. So I don't know that we've really established yet for whom pet ownership is the most beneficial, but I think that understanding the barriers to pet ownership is a really important step to understanding what maximizes those relationships. With animal-assisted interventions, again, there's been research on sort of so many different patient populations. I do think children on the autism spectrum has been an area where there has been a lot of research and some really interesting findings that are positive with regard to social skills and social interactions. I think there's been some great research as well with older adults who are often prone to loneliness and social isolation, especially when moving out of the home. And so that can be an area where animal-assisted therapy can be particularly useful. There's also a great study going on right now. Maggie O'Hare at Purdue University is doing a large trial of service dogs for military veterans, and they've had some really interesting and promising findings so far. So I think that's a population that seems to be benefiting.
Awesome. And along the lines of loneliness, this is a big topic during the COVID-19 pandemic. A lot of people are at home, social distancing comes with social isolation, which has a lot of negative impacts on mental health that we discussed last episode. There's also been a lot of people who've been at home and rescuing animals. So can you talk about kind of the patterns during COVID-19 in terms of pet ownership, pets for dealing with loneliness?
Yes, absolutely. I think this is a really huge topic, and we've all seen the headlines about how many people were adopting pets during the pandemic. And so there's been some research that started to emerge on this, particularly with adult samples. They're often sort of convenient sampling. So, they're reaching out to people after the pandemic started, because obviously no one knew that the pandemic was going to start. So, seeing how people are interacting with their pets during this time. And a lot of individuals seem to report that having their pets has been beneficial for them, although there have been some mixed findings as well. There's been some interesting work on stress associated with being able to get care for your pet during the pandemic, what you might do if you were to get sick and, getting someone to care for your pet. So that part is really interesting, but it seems anecdotally that there's been an increase in adoptions because of people specifically thinking that this is a good time to get pets. Of course, there's the whole issue of what's going to happen when we all go back to work. And
right.
I know my dog really enjoys having us at home, and we'll see how he feels about, us going back to work eventually. So I think there's that piece of it as well.
Yeah, they're going to have to get their own therapy animals. We'll have to buy them all goldfishes.
I know. It's really interesting. I think it'll be fascinating to see how that evolves.
Absolutely. I love what you keep mentioning about the mixed findings too, because this is something that I don't think scientists like ourselves do, always a great job of communicating and it's hard to communicate that it's not always black and white in science, that there's always nuance. And especially when you're dealing with people, as you mentioned, where things are a lot more complicated than, we would like in our ideal experimental settings. But yeah, can you talk a little bit more about that aspect?
Definitely. People are complicated and animals are complicated. And so, it's like you said, it's never black and white. We're never going to find that pet ownership is a panacea for everything. It's not a silver bullet. So we have to think about how we make our science better to help address some of these relationships. How do we figure out what's going on in the relationships? I think we're really moving towards looking at relationship quality, that looking at pet ownership as a predictor of health is really not as nuanced as we need it to be. It's really about the quality of that relationship and what's going on. And measuring the quality of human-animal relationships is actually kind of hard, because you think about all of the differences between species, how you might interact with your dog versus your horse even, and how you kind of compare apples to oranges. So I think that's one of the directions we're going, is having better measurement tools. Attachment is something that we have historically measured in human-animal relationships, which is a really important measure. But there's also lots of other pieces of that relationship beyond attachment. You could have really high attachment, but your pet could also be causing you a lot of stress due to behavioral or medical issues. So I think really getting more nuanced and even drawing from some of the research that's been done in family settings and interpersonal relationships within families can be really helpful in understanding our human-pet relationships. And then also realizing that pets usually exist within the ecosystem of a family, and that all those interactions within that family kind of contribute to the overall picture. And for some people, having a pet might be really important for their health. So if you say live alone and you're experiencing a lot of social isolation during the pandemic, that pet might have a pretty large impact on your loneliness. If you are living in a large family setting where you have a lot of kids running around and lots else going on, maybe the pet is not sort of explaining as much of the change there. So again, it's really individual.
Yeah, very, very family and individual specific. So that's as close to a recommendation that I think we'll get from you without getting too nuanced. But What resources or what things would you like folks to know about if they want to learn more about this topic or even want to try some of these interventions?
Absolutely. I think Pet Partners is a great resource for animal-assisted interventions. As a disclosure, I am involved in the organization, but I think they just do a really nice job of having high quality standards for animal assisted interventions and really making sure that animal and human well-being is accounted for. So they're a big national organization that does evaluations of therapy animals and has a lot of training and just great informational resources on their website. And then the professional organization for anthrozoology research is the International Society for Anthrozoology, which is really kind of the science-focused organization that's doing a lot of work in this area and disseminating a lot of findings.
Awesome. So we will link to both of those in the bio of the podcast.
Great.
I want to thank you so much for your time. This was so wonderful, and I wish you lived closer again so I can meet your animals and we could do an animal exchange.
Absolutely. Well, it was great. Thanks so much for having me to talk about all this.
Thank you.
Thanks.
That wraps up another episode of Brainstem. Please subscribe to the podcast, share it with friends and family, and follow us on social media at Brainstem Podcast. Thank you so much for listening.